When we treat misophonia, we have to look at the whole picture. Now, what's interesting is with misophonia, there can be a lot of co-occurrences of other disorders. So we see very commonly things like obsessive-compulsive disorders. We see Tourette's syndrome. We see attention deficit disorders. We can see anxiety disorders. And it's important to understand misophonia is a unique condition. It can co-occur with these other conditions as well, but we want to treat the misophonia by itself. When we do this, the easiest way that we do this is through sound therapy. So sound therapy allows a patient to take back control of the misophonia. When sounds are distressing, we want to try to avoid those sounds. But that's not really something that we can do when we're trying to have jobs, we're trying to be in a classroom, we're trying to be socially connected to people. So sound therapy allows a patient to control how much of sound they hear, how much of a trigger sound they have access to. This can reduce the feeling of panic, it can reduce the feeling of anger. And so it begins to change in the brain the limbic response. What we're doing over time is giving patients control of what they hear, and we're neutralizing how the body responds to that sound. So we're reestablishing new neural pathways over time. Sound therapy, we have lots and lots of research that goes back 20, 30 years. We are able to pull from tinnitus retraining therapy research. The good news is we also have research from cognitive behavioral therapy, and we can pull all of this together to really treat the patient holistically. So sound therapy is a really great tool, but we need to look beyond that. What is the brain doing? What is the body doing? What is the emotional response to this distressing sound? Cognitive behavioral therapy is a great tool. We provide exercises for patients to try to cue the nervous system to remain calm and to be soothed. So an example of this is your nervous system has two buckets. We are really familiar with our fight-flight bucket. We've all experienced fight-flight. An example of this would be a police car pulls up behind you and those lights start flashing and your limbic system activates. Your heart rate elevates, your sweat response changes, your body goes into fight-flight. But the opposite is actually also true. If our body is not in fight-flight, it's operating out of rest-digest. We are able to use neuroscience to cue our body's natural rest-digest system. There are lots of great ways that we can do this. Deep breathing techniques give our body more oxygen and it helps to cue rest-digest. We know that for a lot of misophonia patients, hyperacusis patients, exercise is a huge relief factor for stress. Hyperacusis and misophonia are actually both stress-sensitive conditions. We know that stress can naturally activate more limbic system, more fight-flight response. So if we are doing things to better our health, we're getting better sleep, we're getting better exercise, we're doing deep breathing or relaxation techniques, those are all ways that we can cue our body's natural restorative process of rest and digest. And so we use that as part of cognitive behavioral therapy with these patients.